Good morning, and welcome to Ageless Health. I'm here today with information that could potentially save your life or the life of someone you love. At 65, Margaret thought her stomach pain was just part of getting older. The fatigue? Well, that seemed normal too. Even when her skin started looking a bit yellow, she figured it was just the lighting in her apartment. It wasn't until her daughter insisted on a doctor's visit that Margaret discovered she had pancreatic cancer. The good news? Margaret caught it early enough for treatment because she recognized the warning signs we're about to discuss. If you're over 60 or caring for someone who is, this video could be the most important 15 minutes you spend today. Pancreatic cancer affects over 60,000 Americans each year, and seniors are at highest risk. But here's what most people don't know. There are 8 specific warning signs that your body gives you, and recognizing them early can make all the difference. Before we start, please hit that like button if you value your health, and subscribe with notifications on so you never miss our life-saving health information. Your engagement helps us reach more people who need this vital information. Now, I need you to pay close attention because these 8 symptoms might shock you. They're not what most people expect, and that's exactly why they're so dangerous. Some of these signs are so subtle that even doctors sometimes miss them initially. Ready? Let's dive into these 8 critical warning signs that every senior needs to know about pancreatic cancer. Let me be completely honest with you about why pancreatic cancer poses such a unique threat to those of us over 60. As we age, our bodies undergo significant changes that create the perfect storm for this disease. Your immune system, which has protected you for decades, naturally weakens over time. This process, called immunosenescence, means your body becomes less efficient at detecting and destroying abnormal cells before they become cancerous. But that's not all. Your pancreas has been working hard your entire life, producing the enzymes you need to digest food and the insulin that regulates your blood sugar. After 60-plus years of service, this vital organ becomes more susceptible to the kind of cellular damage that can lead to cancer. Here's the real challenge. The symptoms of pancreatic cancer often masquerade as normal aging. That persistent back pain? Many seniors assume it's arthritis. Feeling more tired than usual? That seems like a natural part of getting older. Even weight loss might be dismissed as finally losing those extra pounds. This is exactly why pancreatic cancer is so dangerous for our age group. We're conditioned to expect aches, pains, and changes in our bodies. We don't want to be seen as complainers, so we tough it out. Meanwhile, precious time slips away. The statistics are sobering. Pancreatic cancer has a 5-year survival rate of just 11% overall. However, when caught early, before it spreads, that number jumps dramatically to around 39%. Early detection literally saves lives. Another factor working against us is polypharmacy, the multiple medications many seniors take for various conditions. Side effects like nausea, fatigue, or digestive issues might actually be early cancer symptoms, but we attribute them to our medications instead. Your medical history can also mask warning signs. If you have diabetes, you might not recognize that sudden changes in your blood sugar control could signal pancreatic cancer. If you have heart disease, you might dismiss new fatigue as related to your cardiac condition. But here's the empowering truth. Knowledge changes everything. When you know what to look for, you become your own best advocate. If this information is already opening your eyes to symptoms you've been ignoring, please hit that like button right now. And drop a comment below. Have you or someone you know experienced any concerning symptoms that were initially dismissed? Your story could help another viewer recognize their own warning signs. Now, let's examine those 8 critical symptoms that could save your life. Warning sign number 1. Persistent abdominal pain. This isn't your typical stomachache. Pancreatic cancer pain typically starts in your upper abdomen and can radiate straight through to your back, almost like someone is pressing a hot iron against your spine. The pain often worsens when you lie flat and may improve slightly when you lean forward or curl into a fetal position. Why seniors miss it? At 70, Robert had been dealing with lower back pain for years due to arthritis. When he started experiencing this new upper abdominal discomfort, he assumed it was related to his existing back problems. He took over-the-counter pain relievers and figured it would pass. Many seniors make the same mistake, attributing new pain to existing conditions or normal aging. The key difference: this pain doesn't respond well to typical arthritis medications or position changes that usually help back pain. It's persistent, gnawing, and often worse at night. Unlike muscle or joint pain that comes and goes, pancreatic cancer pain tends to be constant and progressively worsens. When to seek help. If you experience upper abdominal pain that radiates to your back for more than 2 weeks, especially if it's interfering with your sleep or daily activities, contact your doctor immediately. Don't wait for it to become unbearable. Also, if the pain is accompanied by nausea, vomiting, or changes in your appetite, these are additional red flags requiring prompt medical attention. Warning sign number 2, jaundice, yellowing. Jaundice occurs when a tumor blocks your bile duct, causing bilirubin to build up in your bloodstream. This creates a distinctive yellow tint to your skin and the whites of your eyes. You might also notice your urine becoming dark amber or tea-colored, while your stools turn pale or clay-colored. Why seniors miss it? Dorothy noticed her eyes looked a bit yellow, but she thought it was just the new lighting in her bathroom. Many seniors have vision changes that affect how they perceive colors, or they might attribute skin changes to medications or other health conditions. Some dismiss it as a liver issue if they've had previous gallbladder problems. The progression can be gradual, making it easy to overlook. Family members often notice it before the person themselves does. Additionally, jaundice from pancreatic cancer might not initially cause pain, unlike gallstones, which makes it seem less urgent. When to seek help. Any yellowing of your skin or eyes requires immediate medical evaluation. Don't wait to see if it improves on its own. If you notice dark urine combined with pale stools, this combination is particularly concerning. Even if you feel fine otherwise, jaundice is never normal and always warrants investigation. Contact your doctor the same day you notice these changes. Warning sign number 3, unexplained weight loss. This isn't the gradual weight loss that might come from eating smaller portions or being less active. Pancreatic cancer causes rapid, unintentional weight loss, often 10 pounds or more in a matter of weeks. The tumor interferes with your pancreas's ability to produce digestive enzymes, meaning your body can't properly absorb nutrients from food. Why seniors miss it? Eleanor was actually pleased when she lost 15 pounds in 6 weeks. She'd been trying to lose weight for years and thought her appetite changes were finally paying off. Many seniors welcome unexpected weight loss, especially if they've struggled with their weight. Others attribute it to stress, grief from losing friends, or simply eating less as you get older. This weight loss is different because it occurs regardless of your eating habits. You might even maintain your normal appetite but still lose weight rapidly. The loss often includes significant muscle mass, which can make you feel weaker than typical dieting would. When to seek help. Losing more than 5% of your body weight in 6 months without trying should prompt a medical evaluation. For a 150-pound person, that's just 7.5 pounds. If you're losing weight despite maintaining your normal eating habits, or if the weight loss is accompanied by loss of appetite, see your doctor within a week. Keep a record of your weight changes to show your healthcare provider. Warning sign number 4, digestive problems. When your pancreas can't produce enough digestive enzymes, your body struggles to break down fats properly. This leads to steatorrhea, pale, greasy, foul-smelling stools that may float in the toilet bowl. You might also experience persistent nausea, bloating after meals, and a feeling of fullness even after eating small amounts. Why seniors miss it? Harold blamed his digestive issues on the new blood pressure medication his doctor prescribed. Seniors often attribute gastrointestinal symptoms to medication side effects, dietary changes, or existing conditions like acid reflux. The changes can be gradual, making them seem like a normal part of aging or medication adjustment. Many seniors also become less attentive to bathroom habits, considering digestive changes as simply another inconvenience of getting older. Additionally, if you've always had a sensitive stomach, these new symptoms might not seem significantly different from your baseline. The distinctive feature. These aren't typical occasional digestive upset. The stools are noticeably different, greasy in appearance, and particularly malodorous. The nausea tends to be persistent rather than related to specific foods or times of day. When to seek help. If you notice a persistent change in your stool consistency, color, or odor lasting more than 2 weeks, especially if accompanied by ongoing nausea or bloating, schedule an appointment with your doctor. Keep a food and symptom diary to help identify patterns. If you're losing weight along with these digestive changes, consider it urgent. Warning sign number 5, new or worsening diabetes. The pancreas produces insulin, so tumors can disrupt this crucial function. You might develop diabetes for the first time in your 70s or 80s, or if you already have diabetes, your blood sugar levels might suddenly become difficult to control despite following your usual routine and medications. Why seniors miss it? When 68-year-old Patricia's blood sugar levels started climbing despite her careful diet, she assumed it was just her diabetes progressing naturally. Her doctor increased her medication, and everyone thought that would solve the problem. Many healthcare providers and patients expect diabetes to worsen with age, making this symptom particularly insidious. New-onset diabetes in seniors without typical risk factors, like obesity or family history, is especially concerning. However, this connection isn't always made immediately, particularly if the focus is on managing the diabetes rather than investigating its sudden appearance. The concerning pattern. If you develop diabetes after age 65 without obvious risk factors, or if your previously well-controlled diabetes suddenly becomes erratic despite no changes in diet, exercise, or medication compliance, this warrants investigation beyond simple medication adjustments. When to seek help. New diabetes diagnosis after age 65 should prompt discussion with your doctor about pancreatic cancer screening, especially if you don't have typical diabetes risk factors. If your existing diabetes suddenly becomes difficult to control, don't just accept medication increases. Ask about underlying causes. Request additional testing if your blood sugar patterns change dramatically without explanation. Warning sign number 6, overwhelming fatigue. This goes far beyond normal tiredness or the fatigue that comes with aging. Pancreatic cancer fatigue is profound and debilitating, the kind that makes simple tasks like showering or making breakfast feel exhausting. It doesn't improve with rest and interferes significantly with your daily activities. Why seniors miss it? At 72, William figured his increasing fatigue was just part of getting older. He'd retired recently and thought maybe he was just slowing down naturally. Many seniors normalize extreme fatigue, attributing it to age, medications, or other health conditions they're managing. This fatigue often develops gradually, making it harder to recognize as abnormal. Family members might notice you're sleeping more, declining social invitations, or struggling with activities you previously managed easily. However, this is often attributed to depression, seasonal changes, or medication side effects. The distinguishing factor, this fatigue doesn't respond to adequate sleep, reducing activities, or addressing other health issues. It's persistent and progressive, often accompanied by a feeling of weakness that makes your limbs feel heavy. When to seek help. If you experience profound fatigue that lasts more than 2 weeks and doesn't improve with rest, especially if it's interfering with your ability to perform daily activities, discuss this with your doctor. If the fatigue is accompanied by any other symptoms mentioned in this video, consider it more urgent. Don't accept "you're just getting older" as an adequate explanation. Warning sign number 7, mood changes, depression/anxiety. Pancreatic cancer can cause significant changes in brain chemistry, leading to unexplained depression or anxiety that seems to come out of nowhere. You might feel hopeless, lose interest in activities you previously enjoyed, or experience persistent worry that feels different from normal concerns about health or family. Why seniors miss it. When 75-year-old Grace started feeling depressed, her family assumed it was grief from losing several friends recently. Depression and anxiety in seniors are often attributed to life circumstances, health problems, loss of independence, grief, or social isolation. Mental health symptoms are frequently seen as understandable reactions to aging rather than potential medical warning signs. Healthcare providers sometimes focus on treating the depression without investigating possible underlying medical causes. Additionally, seniors might be reluctant to discuss mental health symptoms due to generational stigma around these issues. The distinctive pattern. This depression or anxiety often appears suddenly in people without a previous history of mental health issues. It doesn't respond well to counseling or lifestyle changes that typically help situational depression. The mood changes might precede any physical symptoms by weeks or months. When to seek help. New onset depression or anxiety after age 65, especially if you've never experienced these issues before, warrants medical evaluation beyond mental health treatment. If mood changes are accompanied by physical symptoms like weight loss, pain, or fatigue, mention all symptoms together to your doctor. Don't let mental health symptoms be dismissed as simply part of aging. Warning sign number 8. Blood clots. Pancreatic cancer increases your risk of developing blood clots in your legs, deep vein thrombosis, or lungs, pulmonary embolism. You might notice sudden swelling in one leg, often accompanied by pain, warmth, or redness. Clots in the lungs can cause chest pain, shortness of breath, or a rapid heart rate. Why seniors miss it? Frank thought his leg swelling was just from sitting too long watching television. Seniors often have circulation issues, varicose veins, or take medications that can cause swelling, making blood clots easy to overlook. Additionally, reduced mobility can make leg swelling seem like a natural consequence of inactivity. Many seniors also have existing heart or lung conditions that can cause similar symptoms, leading to delayed recognition of blood clots. The symptoms might be attributed to existing medical conditions rather than investigated as potentially new and serious problems. Blood clots associated with pancreatic cancer often occur suddenly and may affect just one leg rather than both. They're typically more painful and cause more dramatic swelling than typical circulation problems. When to seek help. Any sudden onset of leg swelling, especially if it's just one leg and accompanied by pain or warmth, requires immediate medical attention. Chest pain, sudden shortness of breath, or rapid heart rate should prompt emergency care. Don't delay. Blood clots can be life-threatening and require immediate treatment. If you have multiple risk factors for pancreatic cancer and develop blood clots, ensure your healthcare team investigates potential underlying causes. Now that you know these 8 warning signs, here's exactly what you need to do today to protect yourself and your loved ones. First, conduct an honest self-assessment. Go through each of these 8 symptoms and ask yourself, have I experienced any of these in the past few months? Be truthful with yourself. Write them down if necessary. Sometimes seeing symptoms on paper makes patterns more obvious. Next, if you've recognized any of these warning signs, especially multiple symptoms, don't wait. Contact your doctor this week. When you call, be specific. Don't just say, I don't feel well. Instead, say, I've had persistent upper abdominal pain for 3 weeks, or I've lost 12 pounds in the last month without trying. Specific information gets faster attention. If you have multiple symptoms, treat it as urgent. Same-day or next-day appointments are appropriate when you have concerning combinations like unexplained weight loss plus digestive changes, or new diabetes plus persistent fatigue. For prevention and overall pancreatic health, focus on these lifestyle choices. Maintain a diet rich in colorful vegetables, lean proteins, and omega-3 fatty acids from fish. Limit processed meats and refined sugars. Stay physically active with activities appropriate for your fitness level. Even 20 minutes of walking daily makes a difference. Most importantly, trust your instincts. You know your body better than anyone. If something feels wrong or different, advocate for yourself. Don't let anyone dismiss your concerns as just aging. Here's my challenge to you. If this video has given you valuable information that could save your life or someone else's, please share it right now. Hit that share button and send it to family members, friends, or anyone over 60 who needs this information. Also, comment below with just one word, aware, if you're committed to watching for these warning signs. Your engagement helps YouTube show this life-saving information to more people who need it. Knowledge is power, and you now have the power to catch pancreatic cancer early. Let's quickly recap what could save your life. Persistent abdominal pain that radiates to your back, any yellowing of skin or eyes, unexplained rapid weight loss, unusual digestive problems, new or suddenly worsening diabetes, overwhelming fatigue, unexpected mood changes, and blood clots. Remember, these symptoms are often dismissed as normal aging, but you now know better. Early detection can increase survival rates from 11% to 39%. That's nearly 4 times better odds when caught early. You have the power to change your outcome. Trust your body, advocate for yourself, and don't let anyone dismiss your concerns. Age is not a disease, and significant symptoms are not normal parts of getting older. If this video has opened your eyes to the importance of recognizing these warning signs, please subscribe and hit that notification bell so you never miss our life-saving health content. Your subscription helps us reach more seniors who desperately need this information. Share this video with every senior in your life, your parents, friends, neighbors, or anyone over 60. One share could literally save a life. Next week, I'll be covering the 5 early warning signs of colon cancer that seniors often miss. Make sure you're subscribed so you don't miss that crucial information. Until then, stay informed, stay healthy, and remember, you are your own best health advocate.